Emergency pop quiz, and today we're talking about lactate. Okay, we'll get to a little bit more about what lactate is and why we measure it, which I feel a lot of people do ask me in a moment. But first, the question is lactate a valuable prognostic indicator? Okay, is that true or false? And by prognostic indicator, we mean that the vets can take the value and help determine a prognosis for that patient and how likely that patient is to survive. The answer is that it is true. So lactate is a product produced during times when the cells are working with low oxygen. So in our critical patients, our patients who are in shock and are hypoperfused, their cells are not happy, they do not have enough oxygen to work with. So in a response to that, one of the things they produce is lactate. Okay, that helps to contribute towards lactic acidosis in our patients as well, which we see commonly in critical patients. Now, monitoring a one-off lactate at the time the patient presents means nothing. It's going to be high. That tells us our patient is hypoperfused, which we likely already know. When it becomes valuable is when we take pre and post-treatment measurements. We take the pre-measurement and it's high, and then after treatment or during treatment, we want to see that lactate is coming down, and not just by 1 or 2 units. We want it coming down by several units at a time. That tells us that our patient is improving and improves prognosis.